Welcome at Lecto. Today we are going to discuss mammary gland. Mammary gland is basically a subcutaneous gland, means it present beneath the skin. It is present in both male and female, but it develop only in the female. Right? At puberty, in male, a hormone which is called testosterone is produced, which reduce the growth of the mammary gland. And in female at puberty, estrogen hormone is produced, which help in the further growth of the mammary gland. Let's see what the structure of mammary gland is. Here you can see this is the lateral view of the mammary gland, and here is the ribs, right? And above the ribs there is a pectoralis major muscles, and above the pectoralis major there is a pectoralis fascia, and above the fascia there is a layer which is called mammary layer. This layer actually support the breast in the upright position. Here you can see the structure of the breast. Here is the nipple of the breast, and different tube-like structures derive from it. And these tubes-like structures are called Lactiferous duct, or you can say milk duct or mammary duct. There are several names, and before it will open into the outward, there is a sinus like structure which is called Lactiferous sinus, or you can say ampulla, right? And when it will move forward, then there are lobe-like structures. Here you can see there are several lobes present at the end of the duct. Here you can see a lobe-like structure which is called lobes, and normally 15 to 25 lobes are present in mammary glands, and in a lobe there are further small lobes which is called lobules in them. Lobe contain several lobules in them, and here you can see there is a ligament, right? There is a ligament which is called Cooper's ligament. It will start at the start of the breast, and it will end toward the rectomammary gland, and it also support the breast in right position, right? This is the lateral view. If we see the breast at the top, then here we can see this one. This is the breast, and there is a nipple which is present over the breast, and around the nipple there is a area, highly pigmented area present around the nipple, which is called areola. which is called areola. Nipple and areola are highly pigmented, right? And around the over the areola, there are several hairs, coarse hair, rough hairs present at the areola. It is not always present in all females, but majority have hairs over the areola. And here you can see at different levels of the areola there is a gland which is called Montgomery gland. Montgomery gland is basically a combination between the milk gland and the sebaceous gland, and it will majority it will act as a sebaceous gland, and it secrete fluid. It secrete fluid during lactation. It means and this fluid has antibacterial action. It means it destroys the bacteria over the areola, and it will help in further process of lactation, so that bacteria don't enter into the uh, child, right? So this is the structure of the top structure of the breast. Organ consists of two components, parenchyma and stroma. Parenchyma are those part of the organ which form the majority of that organ, and stroma form other components of that organ. Here in like the mammary gland, there is a parenchyma, and which is the actually the cuboidal epithelium, because majority of the ducts of the mammary glands are cuboidal, simple cuboidal epithelium, right? It means single layer of cuboidal cells are present in the duct of the mammary gland. And here the second one is the stroma, which contain blood vessels, nerves, and several connective tissues. Basically, three main connective tissues are present in the breast: intralobular, interlobular, and interlobar connective tissues. Intralobular connective tissues contain several things: collagen fiber, reticular fiber, macrophages, mast cells, and eosinophil also. And interlobular and interlobar connective tissues contain adipose and dense irregular connective tissues. We will see where these connective tissues are present in the breast. Here, if you see that this is the structure of the lobe, and if we zoom it, then here is the structure of the lobe, and in it there are several lobules present in it, right? And the lobules are formed by the simple cuboidal cells, duct, and the lobules. Actually, the cell which surround the lobule are called acini. Acini. And the cavity formed in it is the alveoli. Alveolus is actually the cavity or sac-like structure, and acini are the cells which surround that alveoli. And above the alveoli or acini, there is several cells present over it, which is called myoepithelial cells. And outer is the basement membrane, which is present most outside of the cells. So now you see this is there is a duct which is actually the excretory duct, which eventually open into the lactiferous duct and eventually outside of the body. These cells, which is the cuboidal cell, or if we give name, it is specifically then it is actually a lactocyte. Lactocyte, which helpful in the production of the milk. And here, if the milk is produced in the alveoli, this sinus, then milk is produced by the Prolectin. Prolectin help in the production of the milk from the lactocyte. Prolectin is basically a hormone which helpful in the production of the milk from the lactocyte. And oxytocin is a hormone. Oxytocin is a hormone which helpful in the contraction of the myoepithelial cell, and this milk will move towards the lactiferous duct. So here is the different functions of the hormone. Milk is produced with the help of the prolactin, and oxytocin is a hormone which help in the contraction of the alveoli and move the milk to, outward. So if we see what connective tissues are present, intralobular connective tissues are present around the duct, around the this is the lobules and the duct. Intralobular and intralobular form the majority of the. It means that here is the majority part. Here you can see there is a actually a intralobular between the lobule. Intralobular and interlobal are actually form the majority of the breast, which form the adipose tissues, and irregular connective tissues are present in majority of the part of the breast. So this is the structure of the breast during the pregnancy of the trimester, second trimester of pregnancy. But actually in inactive form, these lobes are not present. Instead, there are several ducts present in inactive mammary gland, and here you can see and the tosses of the breast occur, drooping of the breast occur in inactive form. Inactive form, drooping of the breast occur, and there are duct-like structure at the end of the lactiferous duct. And if the milk start producing in the breast, then it will transform into the lobe-like structures. So this is all about the structure of the mammary gland. If you have any question, then you ask me in the comment section. Thank you.